Thanks to everyone for joining. This is the Child Care Development Block Grant hearing, public hearing, one of 3 that we are doing on this year's plan. I'm going to give a short presentation walkthrough of the plan, and then we will pause for a minute because this is a long session, and then we will head into testimonies. We have a full house for people interested in providing testimony today, which is great. So, and then we will go through everybody's testimony. I just ask for your patience. This is the first of the hearings, and also we are trying out new technology here with our partners at NYSEC. So appreciate your patience, and also if there are any issues, please reach out and we'll, triage accordingly. So with that, let's talk a little bit about the block grant. So the Child Care Development Fund was authorized through federal fiscal year 2020. There were regulations issued in 2016, and then most recently in March. We'll get into that in a little bit. CCDF is a block grant to states, and it's one of New York's 4 funding sources for childcare in our state. Right now, our allocation is about $582 million out of our total New York State childcare budget of over $1 billion. You can hit the next slide. So the program is set up to provide resources to states, territories, and tribal grantees focused on enabling low-income parents to work or pursue education training so they can support their families, at the same time promoting learning and development for children. The program also focuses on improving quality of childcare for children. This is just an important kind of framework that the CCDF program and plan, first and foremost, is focused on providing resources and support to families, reinforcing parental support and family choice, as well as kind of promoting learning and development, as well as quality childcare. You can go to the next slide. So what are the goals of CCDF? Like I said, promoting and informing parents about childcare choices, assisting states in delivering high quality early child care, raising the standards of health and safety in childcare, and increasing the number of low-income children in high-quality settings. You can go to the next one. So how is the plan and the block grant applied to the states? The state needs to complete a plan, a 3-year plan. So the plan is the agreement between the lead agency, which is OCSS, and the federal government on how we will be implementing the plan in New York. So the 3-year plan is a federal fiscal year 25-27 plan that we're talking about today. We are currently operating under the 22-24 plan. You can go to the next slide. So to develop the plan, I think a lot of you have heard this timeline before, but now we're coming to the end of this timeline. We are here in May where we're holding hearings for public comment. After these 3 hearings, we will be reviewing all testimony. People will be submitting testimony in writing through, I believe, the 22nd. We'll review all of the testimony and public comments. We will update the plan draft. They'll go through final review and edits, as well as stakeholder feedback in June, and it is due to the Office of Child Care July 1st. The plan is effective October 1st. This is an important point because a lot of what you might have read in the plan is what will be in effect October 1. So some of the things in the plan maybe not happening right now, but will be in effect come October 1. And we'll talk a little bit about that. You can hit the next slide. Welcome everybody who joined. We're just giving an overview of the block grant and the current plan, and then we'll jump into testimonies just for folks who are just joining. So I wanted to spend a minute on the most recent final rule that was issued in February and went into effect at the end of April. So the 2024 Child Care Development Fund final rule updates regulations regarding supporting families, access to child care, and supporting child care quality. Things included in the final rule were focused on lowering child care costs, improving payment and payment processes for providers, increasing child care options, making enrollment easier and faster, and then increasing clarity in the CCDF plan. You can go to the next one. Oh, okay, so this is the actual plan. So before I jump into that, I will be going through each of the sections at a high level, to which you probably have all read the plan and committed it to your heart. But I'll be going through the plan sections and the New York State responses, but also I'll be flagging or highlighting those parts of that section that are related to that final rule. There were several changes in that final rule that then are reflected in the 25-27 draft plan because the federal government is looking at our compliance in our 25-27 plan, or what our plan is to come into compliance. So again, it's a little bit confusing because of the time frame, but essentially I'll be going through this table of contents about what's in the plan and highlighting those parts of that section that are related to changes that are on the horizon. Hopefully that helps. So there are 10 sections. We're going to walk through each, understand if you need to take a break or if you have questions. It's a long little presentation, but hopefully we can go through it because they all have very important different aspects of how New York State administers the Child Care Development Fund. All right, so we're going to jump into section 1. So section 1 is specific about how the program is administered in New York. It's specific to who has the policy decision authority, meaning who is able to oversee the Child Care Development Fund priorities in the state. And then how does the lead agency, which is OCFS, how does the lead agency consult with required partners in developing the plan? So it talks about our leadership, it talks about who the lead agency is, and then also our partners in developing the plan, such as the Early Childhood Advisory Council or the ECAC, our child care resource and referral agencies, as well as the tribal nations that border New York. You can hit the next one. Section 2 focuses on child and family eligibility as well as enrollment and continuity of care. There are 5 questions in Section 2. I'm not going to specifically go into each of them, but the first part of Section 2, which is 2.1 and 2.2, looks at barriers or reducing barriers to family enrollment into the child care assistance program. And then 2.3, 4, and 5 focus on services to vulnerable children and families, like families experiencing homelessness or persons with disabilities. And then continuity of care specifically looks at ensuring that there's some continuity for families, vulnerable families. You can hit the next slide. So how will New York be responding, or what is the draft response for New York in terms of reducing barriers to family enrollment? In 2.1, we discussed the newly implemented adjunctive financial eligibility. Those are big words, so we renamed it fast track eligibility. So this is leveraging other assistance programs and families' eligibility in those programs so that it makes the enrollment process easier for families. So right now we started with the SNAP program, the Supplemental Nutrition Assistance Program, and/or HEAP, which is the Home Energy Assistance Program, and then we'll be adding additional programs shortly. We also are in the process very soon of launching, finally, the Child Care Assistance Application. That is the online form or online application for families to apply for child care assistance. Right now, there are 2 localities that currently have online applications for families to apply. That's New York City has the My City application. Schenectady County also has one. This will allow for statewide implementation. That's very soon, imminent. You can hit the next slide. So 2.3 focuses on services for vulnerable children and families. So the New York State recently amended social services law in 2023, which then allowed for consistency across the state in establishing statewide priorities of the eligible families who are priority for the Child Care Assistance Program. And so it was amended last year and went into effect. That includes families with income between 300% and up to 85% SMI. The families where a child is in need of assistance with an open protective case in the child welfare system or a preventative case. Families in need of services for a child who's been placed in foster care or in home with a certified foster parent. But these are now consistent priorities across the state. There's more, but this is a first part. But these are allowing for consistent statewide priorities rather than having the variability across the different counties, which is how it was prior. You can go to the next slide. These are the state priorities continued. So that was 1, 2, 3 on the previous slide. So 4 is for families with a teenage parent who is attending high school or an equivalency program. 5 is for the caretakers receiving services for domestic violence or is participating in a screening assessment program for being involved in domestic violence or receiving services for being victims of domestic violence, apologies. And then number 6 is where the caretaker is participating in an approved substance abuse treatment program or screening for or determining a need for a substance abuse treatment program. You can go to the next slide. So this is how the final rule weaves into Section 2. And when I say final rule, that's the 2024 final rule, which I just mentioned. So the final rule for looking at eligibility and minimizing disruptions to families, the final rule focused on preliminary eligibility, also called presumptive eligibility, which is currently permissive in New York State. Counties can allow for presumptive eligibility in New York State. The final rule did encourage states to leverage eligibility from other public assistance programs, which is what our fast track eligibility or adjunctive eligibility is doing. It encourages states to coordinate eligibility for children in the same household, which New York is already doing, which is great. It encourages states to have a screening tool for families, which New York has currently. And then it also encourages states to revise their child care assistance application to make it easier for families and put it online, which we are so very close to doing. You can hit the next slide. Great. So Section 3 is on affordability. So it focuses on family, co-payments, the calculation of those co-payments, and when states determine when to waive those co-payments. Hit the next slide. So I think many of you are aware, but OCFS in New York State has taken a number of steps to lower the cost or co-payments that families pay. In last year, in October, OCFS finalized the rule to set the family share or the family co-payment at 1% of the income exceeding the federal poverty level for all families who are required to pay a family share. Not all families are required to pay a family share. So there are some families who are already exempted from paying a family share. So this 1% only applies to those that are required to pay a family share. So this allows for consistency across the state. Previously, it was variable across the counties. It also allows, it's the lowest we can set it. The federal government does require co-payments or some structure of co-payments for the state to have, but they do encourage states to have it at the lowest point possible. So this will allow for it does allow for consistency because districts are no longer able to select the percentage that a family might pay towards child care. You can go to the next slide. All right. I know my friends, a lot of my friends on the phone, this is the section they love the best, is section 4. So this looks at parental choice and equal access, and then payment rates and payment practices. This is all for the child care assistance program. This is not kind of the entire child care market. This is just for how the state establishes equal access and payment rates in their child care assistance program. There are 5 sections. It looks at access to provider options, the variety of options that a state has for childcare, modalities or types of childcare. Also about the market rates or how the state determines the cost of childcare, whether those payment rates are adequate, what the payment practices are, and then how the state is looking at building supply, knowing that we always could use an increase in child care providers. All states could. We can go to the next slide. So to highlight just 4.1 and 2, which is about looking at the full range of provider options as well as market rates, this is where it gets very confusing about dates. Because the plan, like I said previously, the plan is written for things that will be in effect in October 1, 2024, because remember, this is a 2025-27 plan. But we are writing it right now in May, and also in this case, it talks about the market rates, which we completed a market rate survey, but those market rates are not finalized. So this section is a little bit confusing because we're looking at the current policy and then also the upcoming market rates that'll be released shortly. So I apologize if this bounces around a little bit. So in terms of improving child care assistance program payment rates, there's been, as you all know, significant changes in how those payment rates and practices have been improved since 2017 and also 2021. We have seen significant progress in our most recent market rate survey, which is the data that has yet to be released, which will be released soon. 14% of providers reported that CCAP payment rates were too low. That was in 2023 in the fall, compared to 40% of providers who answered that in 2021. So also in 7% of providers reported not being paid enough absences in 2023 compared to 32% and 40% in previous surveys. So we're seeing improvement in what the rates look like and also being paid for absences. As you all know, New York changed the regulation to cover up to 80 absences in the child care assistance program. So that was an improvement in the payment rate and practices for paying providers for those absences. You can hit the next slide. So switching over to 4.34 and 5, looking at the adequate payment rates and also incentivizing for specific types of care that may be in short supply. We recently improved the differential or the additional payment that providers must pay, that local social service districts must pay providers for providing non-traditional hours. That is currently at 5%. And then that those differential rates will also be changed this fall as this plan is going to be amended. So we know that there was most recent changes in the New York State budget. Those rates will be changed in the fall when those go into effect, but because the plan is being written right now, those will then be updated in the plan. So we know that there's a current differential rate of 5%. There will be a change in that, and the plan will be reflected accordingly. In our federal fiscal year 2023, 71% of children who received child care assistance were in licensed or registered settings, and then 29% were in our legally exempt, enrolled legally exempt care system. I apologize if this is over the logo. That's my fault. 70% of providers, see, it goes over the logo, so I apologize on that. But I'm going to read it to you. 70% of licensed and registered providers have accept or care for children in receipt of child care assistance, which demonstrates that families do have access to the majority of providers. So that's looking at that 70% of licensed registered providers serve children with child care assistance. So families do have access to a variety of care options. All right. We can go on to the next one. Oh no, there is a strikeout there. Okay. So Section 5 pivots away from the child care assistance program policies and the parental choice and equal access, and it switches to looking at the entire system of child care and the way all the health and safety requirements that the entire licensed child care system needs to be regulated by. So when I talk about Section 5 and going forward, we're now looking at the entire ecosystem of child care in New York, not just those providers who accept child care assistance, families with child care assistance. So Section 5 looks at our licensing requirements and ratios, as well as health and safety standards. It focuses on the pre-service or the orientation training of those standards for providers. It looks at the monitoring enforcement requirements, as well as ongoing training. It does look at our comprehensive background checks, and then whatever exemptions the state decides for relative providers. So a lot of the changes, there's not a next slide on Section 5 because a lot of the responses are identical to previous plans. Because New York puts the majority of our requirements in either statute or regulation, the responses in this section are largely our either social services law or our regulations when it comes to health and safety requirements. So this section probably looks very familiar to a lot of you because there haven't been updates to social services law in regards to health and safety standards or background checks, even though there was back in 2019. So I'm going to go on to Section 6. Look, we're at 1:30 and we're on Section 6. We're doing great. Hope everybody's still with me. All right, Section 6 is focused on the workforce, and it's focused on supporting a skilled, qualified, and compensated workforce. It focuses on not just the workforce, but also the professional development framework. It looks at ongoing training and professional development opportunities in the state. It looks at the early learning and developmental guidelines. The New York State response here focuses on all the different ways that New York and OCFS supports the workforce and the different components of that professional development framework. I think Many understand that there's a lot of resources and providers or educators in this space. The Early Childhood Education and Training Program, or ECETP, there's details in this section around the also called PDP, administered by PDP. So there's responses here regarding the availability of training for providers through that portal. It also looks at workforce development and the workforce development information, as well as our partnership with the Department of Labor. It also includes information on the Early Childhood Career Development Centers, which New York State supports and OCFS supports, administered by CUNY PDI. Moving on to Section 7. Section 7 focuses on the quality improvement activities. If you remember back at the beginning when I mentioned the goal of the Child Care and Development Fund, which was on parental choice and ensuring parental access, it was around health and safety and building health and safety, health and well-being in child care settings. And it also is about improving the quality system-wide. So this section talks about all the different ways that system-wide New York is focused on improving quality in child care settings. One thing we highlighted here, there's a lot of different answers in this section, but one thing we wanted to highlight here was our assistance and partnership with the Federal State Capacity Building Center, which is focused on creating a definition of quality child care in New York. Of course, we promote quality in a lot of different settings, and we promote quality in a lot of different ways, but we are currently receiving this technical assistance in order to create a more consistent definition, which will allow us to implement additional quality improvement resources and quality improvement programs. We are partnering with Quality Stars New York, which is a phenomenal program that many providers participate in, but not all providers, and we want to make sure all providers have access to, quality improvement opportunities. It also includes the ECETP information, as well as pyramid model, the recent Quality Stars New York investments, as well as investments in the epinephrine auto-injector initiative. All right. Oh, if you could go back to 8. We just skipped 8. I like coordination and partnership. Let's not skip 8. So 8 is specific to ongoing partnerships and coordination. The Section 1 is specific to formal consultation with specific partners in developing the plan. Section 8 talks about ongoing coordination with different partners to expand accessibility, to how the state is using its matching and maintenance of effort funding, which is the other funding that New York puts into childcare, how we coordinate with our childcare resource and referral organizations, the public-private partnerships we may have, and how we're coordinating with the state's disaster preparedness stakeholders. So information in this section talks specifically about the Early Childhood Advisory Council, which New York OCFS is an appointed member of, and I currently serve on the steering committee of. It is co-chaired by the New York State Head Start Collaboration Director, as well as the CUNY PDI Director. But it has a wide variety of state agencies and other partners that meet on a quarterly basis to review the state's early childhood advisory plan. We also have ongoing coordination with the tribal nations that border New York. Some are CCDF grantees. 2 are CCDF grantees, Shinnecock and the Seneca Nation, as well as the coordination with our partners at St. Regis Mohawk, Arkansas. So we have ongoing partnership opportunities and quarterly meetings with the tribal nations to share resources and share overlap where families may be accessing multiple systems, how we can best coordinate support for those families and children. It also asks in this section about coordination with Head Start, coordination with the public health authorities, our collaboration with the state education department, as well as the statewide coordination by the Early Care and Learning Council, or ECLC, which coordinates the CCR&Rs in our state. Section 9 is focused on family outreach and consumer education. It's focused on how the state allows for and sets up for parental complaints and how parents can make a complaint about child care programs or access information on those complaints. There is very specific consumer education requirements that the state has to have on their website about those complaints. And then also, how do we increase engagement, and how do we provide information on developmental screening? So New York highlights in this section are initiatives on building a social emotional health and wellness, on preventing suspension and expulsion, and the various committees. There's a couple different statewide committees that are focused on expanding developmental screenings for children 0 to 3 and specific for us in child care settings. All right, look, we're at section 10. You did it. You did it. All right, section 10 is focused on program integrity and accountability. This is how the state sets up our program integrity and internal controls to ensure the effective management of our grant from the federal government, as well as the implementation of the health and safety rules. So this section has OCFS answering how we oversee the allocation of the federal block grant, as well as any recruitment or any fraud investigation, any recovery that comes. Also, how we implement and oversee the local social service district's program integrity requirements, and those are requirements as part of the Child Care Assistance Program. It is a particularly uplifting section, so I invite you to hang on till section 10 if you haven't. And that concludes a very high-level overview. I should have mentioned at the top is if you haven't had a chance to review the CCDF plan draft, we did post it about 2 weeks ago. Hopefully you got a chance to see it. If you didn't, please take a look. It is on our website. And this information also will be posted on our website if people were unable to join. So we are going to head into testimonies to hear from all of you. A couple reminders, and then Piper, I'm sure there's something that we have forgotten. We sent out an updated order of presentation, and what we're going to do is unmute you when it's time to for your testimony. We ask that you keep your testimony to around 5 minutes. We do have a timer, not to make you nervous, but to make sure everybody gets to speak. And I will gently cut you off if you go too long, but it is only with love and affection to do so. And then please make sure to talk slowly because we have live interpretation. So we want to make sure everybody can hear your testimony, and please make sure to speak slowly for our interpreter. Piper, is there any other kind of housekeeping before we get started with our testimony?
The only thing that I'm going to share with all of you is I'm going to jump ahead to the next slide. We do have several individuals who will be providing testimony in Spanish. We've grouped them all together at the end of the testimonies. And if you would like to hear them, our interpreter, who is fabulous, is going to switch and interpret from Spanish to English for us. And these are the instructions to get to that Spanish interpretation. So there's As long as you're on the web version of this, you can't be on your phone. As long as you're on the actual app version of this on your like computer or desktop here, you'll click the globe icon. You'll then click audio floor. You'll click Spanish, and then what you can use is this really neat volume sensitivity slider to balance the audio between the interpreter and the original audio. So we'll try and bring this slide up again before we switch to the Spanish testimonies. And I think that's all we have. That was my last little housekeeping bit.
Great. So Piper, can we, when we get to the point where we want people to switch over to Spanish, can we bring this slide up again and just say those words again? That would be great.
Yes, I will reiterate that in a little while when we get there. All right.
Great. Okay, so we're going to get to all of you. And I just want to say thank you again for joining this hearing. We're going to do 3 hearings. We're very excited to hear from you. And our first speaker of the first hearing is Miss Vanetta Rhodes. So Vanetta, I'll pass it over to you.
Good afternoon, everyone. Are we going to get to literally see the panelists, or all cameras have to remain closed before I move forward?
Good question. I don't know the answer to that. I think that the way that it's set up, because we have people in different rooms, I don't think we can.
Oh, okay. All right. Well, I will move forward and speak. So good afternoon once again. Thank you for allowing me to participate in the hearing. I will just jump right in. First of all, I'd like to encourage and address sections 2 and section 6. Regarding permanent workforce compensation. I believe that language should be added. In addition, and above supplemental grants, bonuses, and stipends, there should be at least an annual aggregate percentage of the block grant funding, and specifically that is specifically dedicated to salary support for providers to increase wages annually. It can be scaled at or above the cost of living adjustment and addressed to new, current, and veteran employees. And when I say workforce, please understand I mean staff and administration in all child care programs in each modality. So that's number 1. Number 2, I'd like to just further encourage the presumptive eligibility and presumptive enrollment in sections 2, 3, and 4. This should be addressed throughout these sections. So it must be that parents can enroll and are presumed eligible to receive child care assistance while they are waiting for their approval letter from the LDSS from work, so that they can work or their work status is not threatened while they are searching for work, in training, onboarding, or already in their work situations. For presumptive enrollment, all children and families who are registered and enrolled should receive child care assistance year-round, not just based on presence and absence. At least for 1 school year. And for me, a child care year could be something like year round, meaning July 1 to June 31st of the next year, within the schedule agreement set between the parent and provider. Again, regardless of absence, vacation, illness, COVID illness, and or otherwise. However, the absence policies set by the child care program itself must be observed and adhered to, and can be discontinued. The enrollment can be discontinued if abused or something like that by the provider and or the LDSS. For item 3, decoupling should be firm and consistent among all LDSSs. I found that in section 2.2.2. There's a statement there that I, quoted that says there is no requirement to limit authorized child care services based on work, training, and or educational schedule hours. For parents, I encourage to add a sentence that parents will have access to child care assistance beyond scheduled work hours to consistently accommodate continuity of early care and education, consistent daily routine, and access to therapies within the child care environment. And again, in all settings, in all modalities. And then finally, for immigrant asylum seeking families, the whole of 2.2, so really section 2, section 3, and section 4 is absent of addressing immigrant families and immigrant families who right now have compromised status. It should be included in all the areas of the chart that's listed in 2.3, in all sections that I mentioned as well, section 3, section 4, for determination, redetermination, regardless of their immigration status, because they are children first and have a right to access to early care and education. We must be responsive to the needs of children and families in our care, and they should receive that support, especially because they are in the most critical, challenging, and compromising conditions. As well, a differential rate for providers serving documented or undocumented families, asylum seeking families who are in critical need of child care should be given. I have a lot more, but those are the items that I'd like to address right now, and I will send those in writing as well. Thank you.
Thank you. Thank you, Vanetta. Thank you very much, Vanetta. We're going to move on to the next person, who's Stephen Morales.
Hi, good afternoon. My name is Stephen Morales. I'm the New York Policy Director at All Our Kin. We're a nonprofit organization in New York City that trains, supports, and sustains home-based family childcare educators. And we're also proud members of the Empire State Campaign for Childcare. I wanted to start just by thanking the OCFS team for holding this hearing and for your ongoing efforts toward greater transparency and collaboration. That work is really noticeable and appreciated. So this CCDF plan is an opportunity to use federal dollars and the new federal rules to maximize the impact of improvements to our childcare system that this administration has already made. However, unfortunately, right now, this draft as written does fall short of taking full advantage of some of those opportunities. And so we believe that the CCDF plan draft can be improved in the following ways. First, we must prioritize educator compensation. Everyone knows the number one challenge in our childcare system today is lack of compensation for educators, especially home-based family childcare educators, in New York City who make less than $11 per hour on average. This CCDF plan, first and foremost, must move beyond a market rate system. And it's disappointing that this draft doesn't move our state to a cost estimation model. We strongly urge OCFS to commit to a cost estimation model in the final plan. Our state cannot continue a system that pays providers rates that don't fully cover their costs. Second, the federal government now requires paying providers based on enrollment, not attendance. This draft does seem to maintain an attendance-based system. Providers need reliable payments to be able to pay their bills and their staff on time. 80 allowable absences is great, but it simply does not offer the same reliability as enrollment-based pay would. So we urge OCFS to swiftly implement that federal requirement. Next, about prospective payment, this draft continues to defer that decision, prospective payment to local districts. We urge OCFS to shift so that in the final plan, all local districts are required to pay providers in advance for their services. Providers should not have to wait until the end of the month to receive payment for services that they've provided 30 days before. Next, the federal government is now encouraging states to use CCDF dollars to pay childcare providers the maximum base rate, even when it is more than they charge private pay families. This is about fair compensation for educators, ensuring children have equitable access to programs across the state. And we urge OCFS to take this opportunity to pay every provider the maximum allowable rate and end the practice of paying some providers less than others for the same work. I want to turn to family access for a moment. And Vanetta spoke to a lot of these things really well. First, we know that from the time that a family applies for care to the time that they can begin receiving it can take weeks or even months. And while there can be many reasons for that, let's get kids in care as fast as we can by following Monroe County's example and implementing presumptive eligibility statewide. And we should be using CCDF funding for that. This is a federal recommendation. Again, it can be done using federal money. It should not have to come out of local budgets, and that should be implemented swiftly. Finally, we must support provider wellness so that providers can thrive for the long term. And this means ensuring that providers have access to benefits that many of us take for granted, like paid time off and health insurance. To do this, OCFS should expand the definition of allowable program closure days to include sick days and paid time off for providers. And OCFS must also make sure that all family child care providers, including their assistants, have access to health insurance. The family child care unions in our state offer some excellent benefits here, but due to limited funding, those benefits are not comprehensive and they're not available to assistants in group family programs. The state in this CCDF plan must commit to more. So I'll close by saying that these CCDF plans are an opportunity to break down barriers and get around some of the obstacles that exist in our child care system. I want to strongly urge OCFS to implement these new federal rules and my recommendations as soon as possible without applying for waivers. These waivers will only delay much needed reforms. Of course, we recognize that system change takes time, but we need to commit as a state to moving quickly in service of children and providers. Thank you again for your time and your partnership, and I look forward to continuing to work together on these issues.
Thank you, Stephen. All right, moving on, we have Futoshi Mukai. Apologies for my pronunciation.
I understand that the next two speakers are not in attendance today. Is that correct, Jared?
That is correct. Our next speaker will be Audra Walsh.
All right, we're being flexible. We're we're adapting. So Audra, I know you were not immediately up, but you're next on our list. I don't see Audra promoted yet.
I'm attempting to
Yep.
unmute her, but it is not going through.
Okay. Technology is our friend. Does Audra have to push anything, Jared?
I don't believe so. Piper, can you see if you were able to unmute her?
Absolutely. Let me try.
I just sent Audra a request to unmute herself. She needs to unmute herself on her end.
Thank you, Cassie.
We'll see if it works. I appreciate folks being patient. See, I see it being locked for Audra. Like, I don't know that she's actually able to do that. Hmm. And Jared, you can't do it?
I am unmuting her, but it is not working. So I don't know. Me.
Nora,
Can we promote?
I was just going to say, let me try promoting her to a panelist and see if that alleviates this. So
Would be
Audra,
great.
I'm going to make you a panelist, Audra. There you go. And you should be able to just unmute yourself without pressing any buttons. You can just unmute yourself on the computer. If you are a headset, make sure you're not double muted. That often happens.
My apologies, Audra. If you, now you should see a button at the bottom that has the mute, unmute button. And so if you want to hit that, you should be able to hit it now, and it should be able to unmute you. But we are still not hearing you. Okay, so why don't we, Audra, jump in. If it's, oh, go ahead.
Oh, I was going to say, would you like us to skip ahead to the next individual, Nora?
Yeah. So Audra, if you do get it to work, please feel free to jump in, and we'll pivot. But we're going to move on to Linda D'Agostino. And I don't know if you, Audra, want to try calling back in, because maybe it's a connection issue as well. But Linda, if you are available and ready, I think you're next on the list. And Audra, whenever the technology works, just please let us know.
And actually, our next individual is going to be Rita Gadd for today.
Oh, okay. So we're skipping around more. Hold on. Okay, Rita Gadd. My apologies. Thank you, everybody, for being flexible. Rita Gadd, you're next on the list. Oh, no. Are we having the same problem?
We are. I have requested Ms. Gadd unmute to be able to attend.
Oh, no. What's happening, Piper?
Did Rita just drop off?
Yeah, I
just
don't
went
see
to
Rita on the list.
I went to just promote Rita to a panelist, and I no longer see them on the list. Okay, so we'll move along to Maria.
All right. If Rita comes back, we'll make sure to jump Rita into the list. And Maria, how about you? Can we hear you?
Hey, can you hear me?
We can. Perfect. Thank you.
Sure, no worries. All right, so thank you for having me. This is my first time doing this. I don't know if it's your first time offering this, but it's interesting. So we appreciate you having our voices heard. I wanted to first say thank you for the market rate survey this year. I was really taken back by the different questions on there in a good way. It was the first time I felt like OCFS was really trying to hear what our programs look like versus just what are we charging, right? Sort of echoing what Stephen Morales was saying, it being on a true cost of care model versus market rates is really important. I'm not sure how many conversations are being had about true cost of care models, but I think the questions in the market rate survey represent that. So I'd like to hear more at some point if those are conversations that are happening. Also echoing what Stephen said, educator compensation is the biggest challenge for all of our programs. At the end of the day, when staff are working for minimum wage or maybe a little bit above that, which we all know that life is much more expensive than what minimum wage pays, it's really challenging because this is hard work, right? And those of us who are in education and come from an educational background, knowing that 0 to 5 is where now research shows us 90% of their brains develop. Having quality educators in our programs is really, really important, right? There's all the background checks and fingerprinting, but at the end of the day, these people need to know how to handle young children, and you can't get those people when you're competing with school districts who pay better wages and have benefits and have better time off and get those mental breaks. You know, having those school breaks into their school year is what gets them through because it's a hard job. I feel that the health benefits not being part of our role is really detrimental because we also are working with the kids that can't blow their own noses. And we also obviously have our health policies on using gloves for things. But at the end of the day, we're caring for children when they're not always at their very best. And then having to be ratio based, your teachers are out sick and you don't have somebody else to come in. Having all those requirements for having enough extra staff on hand to have, you know, an environment that's a positive place to work is really, really challenging. I don't know how much discussion truly happens on the ins and outs of actually running a program. I'm center based, so, you know, having 98 kids in my building and having to have 30 something staff and have enough on hand so people can call out sick, and we want them to be able to do that. So it's not just about the compensation for sick time. It's also, I have teachers that say, I can't go to the doctor. I don't have health insurance. I can't pay for that. That can't be where we're at, right? We're teaching about Maslow's hierarchy of needs, right? That's what we learn in school. Like, children need to feel safe and have shelter and food and their basic needs met, but our teachers can't have that because of how this system has been made. So it's really problematic. I think I was surprised to hear Stephen actually mention that people are getting paid, you know, a month after for a subsidy, because I'm still about 2 months behind on payment. So ours comes about 2 months after the care is already provided. So it is a real challenge budgeting that way and keeping track of those and making sure you have enough in the bank to pay forward for your teachers. You know, I don't know, again, how much information is given. I think it's really important to talk more about percentages in the childcare world in terms of what percentage goes towards your payroll and your insurance. And that's another thing that nobody's talking about is the insurance crisis in the childcare world. If anybody is unaware of that, it's happening and it's real. And insurance companies are dropping daycares left and right, and the prices are raising, and it's becoming really hard for everybody to be able to afford the liability insurance needed. So, and then the other thing I thought was lacking is no mention on preschool and how are we going to support child care centers that were built on being able to profit and afford raises for teachers on the ratio for your preschool, but our preschools are going to UPK now, and it's putting a really big strain on your programs where you need to raise your rates for infants and toddlers in order to stay open, because we're losing kids to the free UPK program. So there really has been not a lot of discussion on how that has impacted us, and I would like to see more on that. Thank you for your time.
Thank you, Maria. We appreciate you being here. Audra, just checking back to see if we can hear you yet. Okay, so next we'll keep going is Delta Sabino.
Hi, I'm just a daycare provider and I currently own a new daycare, and I wanted to know more information regarding the grant in October, and I'm happy to hear all the information. Thank you so much.
Thank you, Delta. Next, we have, and just checking that Rita Gadd didn't sign back on.
I do not see her.
Okay.
The next person who's in attendance is Regina Carlton.
Okay, so not Renee, Cindy, Jerica.
That is correct.
Okay. Okay, great. Okay, Regina, you are next on the list. Great.
So I sound a little nervous or whatever. This is my first time, so I'm just going to jump right into it. Hope I do well when I get my message request. Hello, everyone. Hope all is well. My name is Regina Carlton, and I am a concerned child care provider and owner of Little Lions Early Learn Academy. My journey in early childhood education began as a retired early childhood special education teacher in New York City. I spent 5 years as an ABA, Applied Behavior Analyst therapist. Applied behavior analysts implement interventions that target specific problematic behaviors in individual students. This experience, coupled with my role as a mother of two and with 3 grandchildren, has given me a deep understanding of the unique needs of children with autism spectrum. I speak of autism spectrum because we just celebrate April in Autism Month, and I just wanted to share my story and experience of what we've gone through. I am sharing my story today to advocate for more funding to be allocated to support children with autism spectrum disorder receiving care in a family group or family child care program. Providers must have the proper training for themselves and staff to ensure that the safety of children with ASD. They must also be provided with the resources necessary to support their development, creating safety protocols, assessing and utilizing sensory-friendly resources, and understanding the needs of children with ASD are some possible supports a provider and assistant provider would likely need. I am a group family daycare provider who serves 12 to 16 children, ages 6 weeks to 12 years of age. Out of the 16, 4 children are after-school students. At present, I have a total of 12 children. Out of the 12 children, 4 are on the autism spectrum disorder. Here are 2 examples of what autism looks like in my program. Child 1 likes to wander. They are interested in water, trains, fire trucks, and cars. Child 1 has a weaker sense of danger than other children. For example, he or she will run to a moving fire truck, not understanding the threat of what can happen. So for child 1, I hired an assistant who works closely with child 1 when going on trips, community walks, and to the park with the support of the lead teacher. Child 2 has different needs and is extremely sensitive to sensory stimulation. Loud noises and bright lights are triggers that cause these intense outbursts of frustration, anger, crying, and screaming. So for child 2, I hired a second assistant who will monitor sensory overload triggers to help support child 2 so that the child doesn't cause harm to him or herself. I am the lead teacher and have 2 assistants assisting me in the group lessons. I have 5 teachers, so I can give my best support to the needs of the children in my program. By recognizing the characteristics of the differentiating autism spectrum disorder, I hope you can better understand the unique challenges that childcare providers face if not given the proper funding to support the needs of this population of children. I feel the need to share my story because after 37 years of experience teaching with children with special needs, I understand what autism spectrum looks like. Child care providers need more funding to maintain the health and safety of children who are diagnosed with ASD. During the 13 years of running my child care program, I've seen a massive increase in numbers of children diagnosed with autism spectrum disorder, as well as children coming into the program who are not yet diagnosed. According to CDC, more children are being diagnosed with the autism spectrum disorder than ever before. As per CDC data, in the year 2000, about 150 were diagnosed with autism spectrum disorder. In 2020, the number increased drastically to about 1 in 36. Children with ASD or symptoms of ASD are coming high in numbers. Some come with diagnosis and others do not. Families of children displaying symptoms of ASD are given an early intervention program referral form. Most of the children are nonverbal, exhibit social and emotional delays, and dysregulated behavior. Because of my unique educational background, I know how to accommodate the needs of each child. Had it not been the workforce retention grad, I would not have been able to hire additional staff required to modify my program and support the safety and education of these students. I suggest that the Child Care and Development Block Grant Act provide funding to child care providers. This funding will allow providers to hire additional staff when needed for one-to-one support of children. Funding would also offer the opportunity for staff to attend workshops and professional development focusing on what autism spectrum disorder looks like and how to support children and families leading up to the following diagnosis. Child care providers must build their awareness and prevalence of ASD and how it manifests at a very young age. Without this understanding, the health and safety of children with ASD is at risk. According to Missing and Exploited Children data, in 2021, 286 children with autism spectrum disorder were reported missing. In addition, children with ASD may exhibit behavioral characteristics that threaten their safety if providers and staff are not appropriately trained in how to support them. Funding is necessary to address these issues adequately. Thank you, Children and Family Services Committee, for allowing me to speak to you today. I hope you will consider my perspective and suggestion solution for this severe issue impacting New York providers, children and their families. We all have one common goal: to ensure the safety and well-being of all children.
Thank you so much, Regina.
Nora, Futoshi Mukai has logged in, so I think we can go back to.
Great, them,
today.
great.
Yep.
Great, so for Cletus Peguero, just hold on one sec. We're gonna pivot to Futoshi Mukai, who was earlier on the list. Futoshi, the floor is yours.
Oh, hi, thank you very much for this opportunity. I'm running a group family daycare at the East Village in New York City for 13 years. Then I do need more teachers for taking care of the children who has something to take care for the individually. So if this grant makes to hire the more teachers, it will be appreciated and then big help for the children in the community. So that's all today. Thank you very much.
I am unable to provide my testimony right now due to an emergency, but I will send it in written form later. Thank you. Hello, as a home child care provider, I am grateful for the opportunity to participate in this forum for the first time. I find the discussions on important topics for children's care very interesting and valuable. It is crucial for providers to have access to information and resources to better care for children and support parents. Despite the challenges of working long hours, the well-being of the children is our top priority. Additionally, we are eager to assist parents in navigating paperwork and accessing services efficiently. Providing additional support for children with special needs and ensuring they have the necessary staff to give them proper attention. Many children in our afternoon programs exhibit serious behavioral issues upon returning home from school. I am thankful for their commitment to taking the information seriously and providing us with tools to stay informed and continue working effectively. I am extremely grateful for the support and information we have received, as it has been crucial in helping us cover expenses like staff salaries and insurance. This aid is vital for the safety of both the children and employees. I am thankful for the opportunity to learn and improve in order to better serve the children and their families. It is important for children to have access to all necessary resources and for us as providers to meet their needs. My daycare is in the Bronx, where there is a high level of need among low-income individuals. I appreciate the efforts being made to provide essential care for all the children in the community. Thank you. Hello, I have been working as a child care provider for many years, with a formal license for 2 years. My opinion may be brief, but it is honest. I appreciate the information you are sharing today and believe it is a valuable opportunity for us providers. With additional resources, we can hire more staff and improve the quality of care for children, which is a priority for me. As a provider, I believe that with increased resources, we would be able to offer improved services and carry out our work more effectively on a daily basis. Thank you for providing the information. I will also send in my written testimony. Thank you.
The information on how to submit is on the screen, and we'll also be sending out this information via email as well. Jared, is there any other folks who were signed up but we weren't able to hear are currently available?
I'm going to check, Nora, 1 second. Nope, everyone who has registered and who attended did so. No one else has jumped on late.
Okay. I think that concludes our hearing today. If there are any questions, please feel free to submit via email, or if there were technical issues, we can maybe move you to a different day. I want to thank everyone for being here. I really appreciate all of your participation. And Andres, thank you very much for your interpretation skills.
All right. Thank you so much, everyone. We appreciate all your efforts, and we will continue to publish the draft.